Mental health space in Nigeria has really been dominated by psychiatrists. Not to say that's bad or anything like that, but just to say that people also need to be part of the conversation. And we know
What would you say are the organization's main goals and objective?
Nigerian mental health is a global community of mental health practitioners. We have over 30 organizations as members, actively leading efforts around psychosocial well-being. We are founded in 2019 to really connect people in Nigeria and the diaspora to strengthen Nigerian mental health programming through community practice, our WhatsApp group, and other networking events. We have four primary objectives. One is connecting Nigerians actively focused on advancing mental health. So that can be, we have, two or three organizations in diaspora, but many of our organizations are here and giving us conversation, giving us collective. And I think one of the best thing that happened from our advocacy for the Mental Health Act was really making sure that we have different professional organizations and voice brought to the forefront because the mental health space in Nigeria has really been dominated by psychiatrists. Not to say that's bad or anything like that, but just to say that people also need to be part of the conversation. And we know whether it's psychiatric nurses or social workers or occupational therapists or pharmacists or the list lay counselors, human rights activists, lawyers, right? Traditional and faith leaders, they're all part of the mental health conversation. So trying to bring these actors together and through our work, we've been able to get on two occasions for supporting passage of the Mental Health Act with the presidency, over 40 organizations, including the four leading mental health organizations, to support that. And then other efforts like our 10-point agenda that I'm sure we'll get into. We had over 40 organizations sign up to that. So how do we connect these actors and give voice to them in the mental health space? Or not give voice, amplify their voices. The second objective is amplifying and strengthening members' efforts on mental health related issues, and that could be on anything. So for me, I used to debate in high school and college, and one of our members was having a debate about different frameworks for how you should approach mental health interventions, one being biomedical and the other psychosocial. So I used my debate background and I chaired the debate. But we have other individuals who require special expertise in autism, and they look within the network, or somebody is knows somebody is going on sites, suicidal episodes, so they can find specific expertise within the network to help support their programming or individual end user needs. The third is increasing awareness and knowledge and resources focused on Nigeria, Pan Africa, and dialogue, diaspora mental health. There's so many errors or issues or challenge when it comes to the mental health space, though it's one of the most cited areas of authority within Africa and definitely within Nigeria, one of the most quoted authorities within mental health. But we have a paucity of data and information. Our data is really 2 decades old, unfortunately. So how do we get best practices information into the hands of individuals so they can incorporate it in a program and help support the ecosystem in terms of those who are really impacted by these challenges? And then finally, conducting programming focused on transformational and sustainable change in Nigeria's mental health landscape. If you have an issue, you should be able to, if you have great people, right, you should be able to come together and do things that are great, that are transformative, but not just transformative and they stop, but sustainable. So we've been pushing a lot of a big, bold initiative, first of its kind efforts, like our policy advocacy efforts surrounding suicide prevention and the National Mental Health Act that we're helping lead at the federal and subnational level, or our information and evidence, which is another one of our programs, what I call our learning agenda, trying to do social media change, behavior change, trying to do research and scoping of what is actually going on in Nigeria's mental health landscape, trying to have conversations and debates on some of the key issues within Nigeria's mental health landscape, and cascade those best practices, whether it's from how people have dealt when people have gone public with their issues with a specific organization in terms of their psychological support, or on crisis hotlines. What are best practices? What are things that people need to know and do? And then things like curriculum reform. And then finally, our final area of programming from policy advocacy, data, and information is wellness. As someone who's really a development practitioner in the forefront or a social development kind of entrepreneur, I'm really concerned about access. And we know that it's hard to access quality mental health services, either because you can't afford them, you can't find them, you can't get recommendations, or people don't have trust in those institutions and they have more trust in their traditional institutions, which is nothing wrong per se, like faith or traditional other traditional chiefs and things like that, where people will go through for their challenges when they really may need more specialized clinical services in order to respond. So how do you help people who have those access challenges? And our wellness pillar is supposed to respond to that. We do things like community healing workshops, which are events based on different types of enrichment, often more accessible, where you find enrichment and coping and healing within the body. Things like affirmations and art yoga and semantic therapy and dance, etc., that could help with healing and coping and support your self care. And we have a safe spaces where we have individuals who which are facilitated, peer-centered therapy circles, which are personal and discuss their people's challenges with the kind of vulnerability and respect that's necessary. And then we have finally, as part of that wellness practice, an immersive conference, which is we hope to happen in October, our first of a kind on a continent. It's going to be a forum for education and experiential mental health activities, really utilizing technology to help simulate what it means to live as a person with a disability or with a mental health condition, and also do wellness practices to the larger public versus the more smaller, intimate community healing sessions, and then also to co-create different ideas around mental health interventions. Because the thing is that people don't really even know what it means to have a mental health intervention. What most people think of is you go to a facility and you're drugged, or you go to a facility and you're chained because the people who have mental health challenges are crazy and they talk to themselves and they're running around naked and they're trying to stab and kill people. And that's actually what the polling suggests. So can we have a contest where we actually share these are what best practices look like, and then support them in a pitch competition? So that's geared for October, and I hope some of your listeners, they follow us on our social media, Nigerian Mental Health. We're on everywhere on Nigerian Mental Health, and on Twitter on Nigerian MH. Or they can follow me, Chime Asonye. I'm Chime Asonye on all social media platforms. And by following us, you can stay tuned to our different programmings, our different activities, including our immersive conference coming up in October.